Welcome to the Off Leash Podcast with Dr. Pete. I'm your co-host, Molly Van Branken, and we are so glad that you joined us for today's show. Remember, we are not here to say what you want us to say. We're here to be an advocate for you and your pet.
Amen?
Amen.
Okay.
So, today we're going to be talking about something that everyone goes through with their dog at some point, or their cat, or their animal. Pain.
Yeah, actually people go through that themselves. And so,
Yeah.
I think we've what we've done in veterinary medicine, we've kind of caught up with what humans been doing for quite a while now.
Yeah. Have you gotten in a procedure where you had to go through pain?
Yeah, I had a hernia repair, and then
Ew, I heard those hurt.
Well, I had a radio show then. I had to get up and go do the radio show the next day, and I got up and I thought, well, you're not supposed to drive when you're taking an opioid. So I thought, well, I won't take the opioid. And then I had what's called wind up, which is where all of a sudden you didn't have pain. Now you got pain because you didn't take your meds.
Yeah, because you got to take the meds. What is it called? It's like
you have to constantly. You can't
constantly.
You can't have.
You can't wait till you do have pain because then it's going to like last through the pill, and then
So here's what happens. So you drive in, you go do your show, and then and you're not taking the opioid, so you in essence really probably piss away 6 hours someday. And then you go back to the house, and then you're like, well, now I'm not driving. I'll just take the pain pill. Take the pain pill, nothing happens.
They gave me Oxy for a procedure. I hated it.
Yep.
It got rid of the pain, but it gave me like terrible night sweats and like terrible nightmares and dreams. And I
mean, they tend to want to go ahead and put stuff together. They'll put that together maybe with Valium to take care of the anxiety and stuff. And then you may have weird dreams, and everybody handles it different.
I was having terrible dreams. I hated it.
Yeah, well, bizarre dreams.
Yeah, it was like these because I don't normally dream. I normally go to sleep and then wake up the next morning. And on the Oxy, I was having these like terrible dreams, a lot of like end of the world dreams.
Sure.
And I was like, they're so vivid.
Well, that is, but that's the art form, and we had to kind of learn that because we weren't taught that in college. So we didn't have non-steroidal anti-inflammatories when I was in college. They had, I think the first non-steroidal they ever came out was something called Rimadyl. And
for dogs?
Yeah.
Is this for dogs?
Yeah. And your dogs had Rimadyl before.
Yeah.
And they have the generic deal called carprofen.
Yeah, carprofen. I give carprofen to my dog after a hunt because she's always sore.
See, and you're doing it backwards, sweetheart.
I need to do it before?
Yeah, you do it when you go out.
Oh.
Okay.
Good to know.
I go play basketball on Monday nights. I take a leave before I go. So I'm swallowing that as I'm getting in the car to go play. So then when you get done, you don't feel bad. And I would suggest people do that. If you're going to hunt your dog or do something athletically with your dog, and you have some
hip dysplasia or pain,
or you have some arthritis, and we talk a little bit about that. I mean, it's like, well, do you have arthritis? Well, hell, I didn't spend my whole life in a waterbed. I mean, of course I have arthritis. Everybody has arthritis.
Yeah.
And then the question is, and we talk about it. It's like when my shoulders are killing me or my right knee's killing me, so I've got a sleeve on it, and I'll put ice on it tonight when I get home. So there's all sorts of stuff you do. We can talk about that today.
Yeah.
What are the things you can do? What are the things you can do? And, how many things can you do? And I would tell you this much, the things that you do, you should have permission to do.
By your vet?
Yeah, by your vet. So
you can't just be popping dogs on aspirin.
No, well, you can't. If you're... Well,
that'll kill them. Well, no, it's ibuprofen.
Well, no. So here's what happens sometimes. Every once in a while, I'll have a dog come in and has a bad back. Okay, that's where the disc has slipped, and now it's in a place where there's no room for the swelling. So do I use non-steroidal anti-inflammatories for that?
Yeah.
No.
No.
No. You use steroids for it.
Why?
Because it takes the swelling out of there and makes the dog feel better. Now, you may add a little gabapentin in with it, but then if you went home and you had carprofen around. So if I gave dexamethasone lasts about 3 to 5 days.
What is Dex? Is that a steroid?
Steroid, yeah.
Okay.
And I give you the gabapentin. I think, okay, I'm good. And then you go home and you say,
gabapentin's also a steroid?
No, gabapentin's it's called neuropetin. It's a different kind of a non-opioid, I guess. Whatever you want to call it. Anyway,
you go home and
then you go home and you think, well, I've got some carprofen left from when I had my dog spayed. I'll just give him that too. The problem is that carprofen will cause an ulcer. And the dexamethasone, the steroid, will keep it from healing, and you'll get you'll perf your bowel. And once you perf your bowel, you are SOL, and I'm sure you know what that means.
Have you had dogs die from that?
Oh yeah, we've had dogs die from that because because clients will give the carprofen for 2 or 3 days in a row and then wonder if it's okay. And they say, well, my dog seems to have an upset stomach now. And I said, yeah. And I said, hopefully, I'm not sure why that is. And he had a bad back. And I'm like, well, nobody gave carprofen or Previcox or Duramax. I said, oh, yeah, we had some Duramax. We found some Duramax. We gave him Duramax. And now you have the Duramax causes an ulcer. The steroid keeps it from healing. So now you get a perfed ulcer. I mean, you can save a lot of those dogs, by surgically going in and fixing the hole.
Yeah.
But that's stupid stuff to do. So I would tell you, I guess I tell anybody that's listening to this that when you're going to do something with your dog, get permission to do it.
Call your vet. Don't just take the reins and do it yourself.
Don't give, and we every once in a while used to see, well, they have a 15-pound dog and they gave it an aspirin.
Yeah.
Well, what would happen? So if you're a 10-pound dog and the 150-pound owner, if you took 15 aspirin, what would happen to you? Ooh, I'd be pretty sick.
Yeah.
That's almost like suicide. That's right.
Yeah.
So why would we do that to your dog? Aleve does not have a safety factor in dogs.
No.
Aspirin does not. Aspirin really not much.
Go to your vet and get the right pain medicine.
Yes.
Dogs experience a lot of pain in the course of their lifetime. So we've talked about joint pain, arthritis. What other types of pains
Abdominal pain, pancreatitis.
Like abdominal pain from what? Like eating something?
Parvo or pancreatitis. Those are the two things I see the most that are caused abdominal pain. And both of those are the kinds of diseases where we just need to wait for them to get better with supportive therapy. Mm-hmm. But you have to control the pain while you're doing that. So in those dogs, you might even put them in a little bit of a coma using a lidocaine drip.
Okay.
They get pretty sedated on that, pretty
Is that
relaxed.
what you want during parvo?
Yeah, because they're not in a position to eat or drink.
Oh.
Okay, so now
are you pumping fluids and food in?
Well, you're not pumping food in, you're pumping fluids in. IV.
Okay.
So, and you just put lidocaine in the bottle. There's a recipe for it. And then you give them IV lidocaine.
Okay.
And then you wait for that. It's like a topical anesthetic, except for in the body. So you can't give you have to be careful how much you give.
Right.
But you can do that. And then what happens is they relax and they sleep. I think we've talked about that before. Sometimes when dogs are in pain and let's say they've been up all night, because their stomach's bothering them, it's really painful. You give them something.
Then they relax.
They relax and sleep.
Okay.
Yep. And I've seen that before. I don't know if you remember that one dog we had came in that one time had a really bad respiratory, had pneumonia.
Oh yeah.
And they couldn't breathe.
You gave that dog lidocaine?
No, we didn't give him lidocaine, but the minute we put him on an antibiotic that made the chest better and put him in oxygen, and he was and he was just frantic because he wasn't getting enough air. And the minute we
did they die from that exhaustion?
Yeah, they die from that, sure, yeah. And so that's, in fact, dogs die from parvo, I think, more from the pain than from the disease itself. The disease is bad, but you have to control the pain during that period of time.
That's wild.
The pain during that period of time. And so that's what you do. You just control the pain. There's all sorts of, we always talk about different antibiotics, different bugs for different drugs. Well, in this case, it's different drugs for different sorts of pain.
Right.
And then you have to figure out how you're going to put them together. Are you going to make a margarita? Are you going to make a Bloody Mary? Are you going to make a Long Island iced tea? So, and most of us have some experiences like, okay, if I'm going to go ahead and do a back, I'm going to use steroids. Now, it breaks down into this with bad backs. You got old people like myself, we use steroids, and gabapentin. Younger people use nonsteroidals like Rimadyl and gabapentin. The kids are wrong. The steroid works better.
Right.
I'll tell you that. But and the clients say it works better. And so, and I'll even have clients that it's a long-term pain thing. I'll even teach them how to give the dexamethasone at home.
Oh, that's cool. Like in a shot?
Yeah, every 2 or 3 days, they got to give an injection of dexamethasone. But they'll have them on gabapentin the entire time.
Right.
And then the client has to learn this. Listen, if you had a dog and had a bad back, it's a Molly thing. So you we'll fix your Molly thing, and then you'll have to be observant enough to know when this wears off and how we're going to go ahead and resolve it until Mother Nature does its thing. So we're usually just sort of filling the gap for Mother Nature while the pain thing sort of wears off.
Speaking of observing, how to see behavioral changes in your dog that are pain related. Do you know what a lot of these are?
Yeah, licking their lips, unable to get comfortable.
Restlessness, lethargy.
Yep.
Or is it? Yeah.
Lethargy.
Lethargy. Appetite changes, sleeping, limping or stiffness, excessive licking. I've seen excessive licking, but I don't think it ever is pain.
Nope. Well,
I don't know. Could that mean something else?
It depends on the dog, but if they don't lick very often and how they're licking, they may have some discomfort.
Okay. And then there's also unusual posture.
Yeah. Well, we have cats that get hypertension, and then
remind me what hypertension is again.
High blood pressure.
Okay.
And then it's like a cat with a migraine, So
they get migraines?
Well, so to speak. But they'll stand there and meow at you. Meow, 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 meow.
That could just mean that they're hungry.
And no, if they got food in their bowl and they're doing that, I mean, and actually when you put them on a vasodilator, the vocalization just goes away. And so you see that. So you just have to learn. It takes a long time to kind of learn all that. But the surgery room used to be kind of noisy, but it's not noisy anymore because we control the pain. We actually give pain meds before we do the surgery.
Just like you said, how before you go to basketball, you take
we don't want wind up.
Yeah.
We don't want wind up at all.
That makes sense.
Yep. And then we got a drug called amantadine, and we go ahead and use that to sort of reset the pain receptors from time to time. We use Librela on dogs for arthritis. Works really good. Lasts 30 days. An injection may even last longer than that. Solensia for cats, same thing. I think that's a little more controversial drug.
Solensia or Librela?
Librela. There's a few complaints from time to time to the FDA about that drug. Yeah. So do we use it? Yeah, I mean, when it works really well. And so
you used it on my dog and it worked really well. But then I got online and everyone was like, Librela made my dog die, and gave it all this problem. I was like, what? I don't know. I don't know why people.
Well, here's the thing you got to remember. Anything that lasts for a long time is going to get blamed for some stuff.
Anything that lasts for a long time?
Yeah, anything that lasts for 30 days, like ProHeart, the injectable heartworm thing, lasts for 6 or 12 months.
How long does Librela last for?
Librela lasts for a month, maybe 45 days sometimes.
Oh, okay.
Yep. So I think it works well. And everybody's going to develop their own clinical impressions as to how things work and if they're effective or not effective. Mm-hmm. And then it's up to clients to go ahead and call you back and say, I think he's having a little bit of a hard time getting comfortable. Maybe we ought to, is there something we can add to this? Mm-hmm. Is there something we can add to this? Yeah, there's always things we can add to this. Yeah. I'm not a big fan of this, but we use it sometimes. I think there's a company called L who makes CBD, and they're sort of the people that make the good stuff.
L?
Yeah.
Just L?
Yeah, ELLE.
Oh, ELLE. I was thinking just the letter L.
Yeah, so you can get online, look at that. And we use that a little bit for seizures, but we don't ever use it primary for seizures. We use it when we're using phenobarb and maybe Keppra. And then
do you use it to prevent seizures or like during the seizure?
No, to prevent seizures. Oh. And then the L drugs are kind of the third player in. And so we use those. There's all sorts of stuff you can do.
Yeah.
You just have to be kind of creative. We have nonsteroidals that don't have an awful lot of side effects, like, what's the one? Begins with G, not gabapentin, but golly, I hate this part.
Forgetting names?
Yeah. I'll remember it as we go on. But
what about more holistic stuff?
Like
red light therapy.
Yeah, I don't think that may be for pain, but that's for chronic pain. And really, I think what we're talking about today is where you've injured yourself or you've had surgery.
Okay.
And I think or you have a disease that's really painful.
I was going to say, or the hydroponic therapy? Where you make the dog swim or something?
Yeah, well, that's rehab.
Oh. Yeah. Well, no, they said that it's good for joints.
Well, it is good for joints, and there's no impact. That's why they think that's good. But most of those dogs are on drugs while they're rehabbing. And in fact, it's a little easier to rehab when you have drugs on board. If it's painful every time you go to see the physical therapist, why you probably got to load up on stuff before you go in there. And probably not Grey Goose, but stuff like Aleve or Aspermox or Bayer aspirin, whatever you got.
Not for your dogs, for us.
Yeah. You have to be careful about the aspirin and
Yeah,
a
I
leave
know
and
some
stuff.
people that give their dogs. I'm like, you can't give your dogs aspirin and a leave.
No, and we see a lot of bad things happen when we do that, and so we have to be kind of cognizant of that, and so that's always a nice thing about it. If you're talking to clients, make sure you tell them this can be the side effects, and this is what I'd watch out for, and this is why I wouldn't do this at the same time. Galliprant is the name of that drug. Galliprant. It's a non-steroidal. It doesn't have an awful lot of side effects like with liver or kidney.
And all these have to go through your vet. You can't just get any of these.
Nope. But we have dogs that are arthritic. If we have dogs that have had joint injuries and stuff, we understand perfectly that what's going to happen is the fall is going to come, and August will be fine. But the end of September, October, November, when it's cold and damp, that dog's going to have a lot of problems. And
just because of the weather change.
Just because of the weather, and really, you talk about this all the time, where you go ahead and the client says, well, I think he's getting along pretty good. And I think I've told you this story before. And people say, listen, he's got this fatty tumor, and my wife wants his fatty tumor off. I said, oh, you don't really need to take that off. And they're like, well, my wife would feel a lot better if we took that fatty tumor off. So
peace of mind.
Yeah, peace of mind. That's right. So we take it off. And if I know the dog has arthritis, I'll send him 15 days with the carprofen home afterwards.
Mm-hmm.
And then they'll come back for the sutures. I got to get those about 10 days. And they say, wow, that tumor must have been bothering because he's felt great since we took it off.
You're like, nope, he's just got arthritis.
He's got arthritis, and now we've had him on carprofen. And he should stay on carprofen probably 2, 3, 4, 5 months out of the year probably. That'd be my guess.
My dog's got arthritis, and you got her on those U-Move?
Yep,
seed-lip muscles?
Yep.
What is it? Green lip muscles,
Green lip muscles, yep. And so that's an omega-3. That's nature's steroid. And that's one of the things.
It doesn't help with pain, though?
Oh, yeah. It helps with pain because you're lubricating your joints. And once your joints are lubricated, they're not painful anymore.
That makes sense.
But you have to do, and that drug works, although it's holistic. It's an omega-3 fatty acid.
Mm-hmm.
But then you're taking omega-3 fatty acids, which is nature's steroid, and maybe comparing it and combining it with real steroid. And there's all sorts of things you can do.
Could you take that in carprofen?
Yes.
The green lip muscle?
Yep. And that's what you would do probably.
I don't have any carprofen. Maybe I should give her some.
Yeah, probably wouldn't be bad. Especially this time of year, it's cold and damp. And so
she's
you would
slow.
do that.
She's slow getting out of bed right now.
But I think that's sort of the client's responsibility to figure out, okay, we did this, and we did this, and we did this and this and this, it worked pretty good. When we just did one of those things, it didn't work as good. So the client has to, it's a Molly thing. It's your dog, and you figure out when she does better. But there's another drug we use called Adequan. Have you heard of that before?
Yeah.
Adequan is an injectable, and it's made out of bovine tracheal cartilage.
Ooh.
We use a little bit for collapsing tracheas and stuff like that, but it's used for arthritis. And then apparently now, I talked to somebody the other day, and I may try this, where if you give gabapentin to a cat, like a tenth of an ml twice a week for 4 weeks, that'll be pretty damn good for quite a while after you get done.
Okay.
And it just allows more fluid to accumulate in the joint, so you get more. And there's a number of people that have that. In fact, I'll send that home for people, and they give it themselves at home, and they'll tell you that, boy, you can tell the difference.
Yeah.
And lots of times in a case where it's a husband and wife, and the man's giving the injection, and the wife doesn't see him do it.
Speaking of wife, your wife's calling you.
Yeah, I know. Yeah, that's the way this would work. Yeah.
Yeah.
So I think that there's all sorts of things, and you just have to have a little of imagination, and you have to be able to involve the client in this. I think that's a big thing. You have to involve the client. They have to be part of what's going on here. If they're not part of what's going on here, it's going to be very successful.
Right.
But here's our goals. Here's what we're looking to do. It may require they come in one or more times, or maybe they have a phone conversation with you. And then you say, what seemed to work the best for you? I gave these two things that worked really well. So let's do this, and maybe we'll add some CBD, or maybe we'll add some Adequan or something like that. And
don't add aspirin or ibuprofen or
those things are not supposed to be given.
No.
So, and that's what they do sometimes with non-steroidals. I don't know if you know this, but sometimes they'll try them on dogs and they don't work, and they'll try them on people and they work, or vice versa.
Yeah.
Yeah, they try them on people, they work. They try them on dogs, they don't have a very good safety factor.
Mm-hmm.
And so you just have to be careful, and you can't mix steroids and non-steroidals at the same time. That's a big no-no.
Big no-no.
Yep, the nonsteroidals cause ulcers, and steroids keep them from healing.
Oof.
Yep. So
And your dog might die.
Yeah. So, I've had a number of things. In fact, we had a guy in our practice that did acupuncture.
Yeah.
And that worked pretty good. But does it work all by itself? You can.
It's hard to find somebody to do acupuncture on a dog. I think Bob does it.
Yeah, Bob Emery. Yep. And he's very good at it. But you have to usually add something in with it. And so that's the thing. You get these real difficult cases, and it isn't just a thing you do.
Yes.
It isn't sometimes even two things you do. It's everything you do. And then when you come on the road, we talk about your mother. It took her a while to figure out how to make banana bread at one time. And so she tried this. And then
I have a hard time believing that.
And tried that. Well, she sometimes puts...
She makes it every damn week.
I know, but she sometimes puts healthy stuff in there.
Oh, my God. Flaxseed and nuts and all that shit.
Yeah, I know. Yeah.
Makes it bird seed.
Yep.
And I'm like, just put chocolate chips in it. What people want.
Yep. Yeah.
You tell her that.
You
call her back and tell her we're talking shit about her on the air.
Okay. But really learning how to control pain in dogs and really making banana bread ain't a hell of a lot different.
It's just figuring out what
works.
What works.
And what works for your family, not everybody's family. What works for your family. See,
the flaxseed might work for like a Colorado family.
Yeah.
They like all that natural crap out there.
Yeah. But I would, and I think that if you're going to drop your dog off for surgery, I think it's kind of important that you tell the people, I'm concerned about pain control.
Mm-hmm.
Make sure
you're giving your pain control too.
And really, you have to make sure you tell them. Some dogs are really stoic about all this stuff, and they're tough. And some dogs aren't. And if your dog isn't tough, tell the veterinarian, hey, listen, my dog's not very tough.
Kind of a wuss.
You're kind of a wuss, and so keep that in mind when you send the drugs home.
I had someone tell me, they were like, I just got my dog fixed, and I gave him the drugs, like the painkillers for 2 days, and he was like, and then I forgot to give it the third day, but the dog's acting fine. I was like, well, that's a tough dog.
Well, but the pain ran out.
Did it? After 3 days?
Well, so it's a fairly simple incision.
Ugh.
Yeah, so you're not tearing.
I was like, you don't stop giving it.
You're not tearing a lot of stuff apart. So a lot of times, 3 days worth of a nonsteroidal makes them pretty good.
Yeah.
Yeah.
I guess.
Yeah, but if you have something where you're really taking muscles apart and doing this and doing that,
then there's going to be a lot of pain.
Yeah, and you need to do that. So there's all sorts of pain: abdominal pain, skeletal pain, mental pain. It's like, but there's all sorts of pain and injury pain, which is different than arthritis pain, because injury pain gets worse as the day goes on. Arthritis pain gets better as the day goes on because you get loosened up and everything. So
exactly.
Yep.
Well, is that all you got for pain today?
Yep. I think we're done on this. I think
this podcast wasn't very painful either.
No.
All right. Well, on that note, I'll get some outro music going.
Okay.
We sure appreciate you guys listening along with us today. We hope that we've been able to share some important information that will help you love your animals as much as they love you. Don't forget, always treat the treatable, prevent the preventable, and we will catch you on the next episode of Off Leash with Dr. Pete.
Very good.